Good evening and welcome to our COVID-19 special edition on Channels Television. I am Ladi Akeredoluale. Here are some of the highlights tonight. Federal government upgrading health centers, pondering relief measures for Nigerians as COVID-19 pandemic continues to take center stage. Lagos State Governor signs disease and infection control bill into law. And world leaders wish British Prime Minister Boris Johnson speedy recovery from COVID-19, which he tested positive to today. We begin tonight with the latest of the figures from the Nigeria Center for Disease Control, the NCDC, which has just confirmed that 5 new cases of COVID-19 were recorded today. 3 of the cases are in the Federal Capital Territory, Abuja, and 2 are in Oyo State. The latest confirmed cases brings the total number in Nigeria to 70. With these new confirmed cases, Lagos has 44 cases. The FCT has 14, Ogun and Oyo have 3 each, Bauchi has 2, with 1 each in Ekiti, Edo, Osun, and Rivers states. The federal government is upgrading major health centers in Nigeria to curtail the spread of the COVID-19 pandemic. The Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, said that a multi-sectoral committee to draw up a program to ensure proper health care for Nigerians during this period is in place.
We have so far shown that the country is able to respond adequately to the health crisis. Healthcare facilities are being upgraded. We have found resources that we can put to also further upgrade. The President has set up a multi-sectoral committee that is chaired by the Secretary of Government of the Federation that has key MDAs as members and also some healthcare experts. They've designed a program and costed their program, and we now need to find the resources to provide these resources so that in every state of the Federation, there are major healthcare facilities that are upgraded to enable us respond to the health crisis.
Minister of Finance, Budget and National Planning, Zainab Ahmed. No ship will be allowed to come to the shores of Nigeria except if it has stayed offshore for 14 days, and then it will be allowed in after its crew members have all been tested. The Minister of Health, Dr. Osagi Ehanire, gave the directive at a media briefing on the COVID-19 situation at the Health Ministry headquarters in Abuja. Dr. Ehanire says that the federal government has approved 5 billion naira intervention fund for the Nigeria Center for Disease Control to help strengthen its capacity, while Lagos State has been given a 10 billion naira grant for the same purpose. The minister adds that the Chinese government has promised to provide technical support in form of supply of public health experts who are in the forefront of efforts to stop the spread of COVID-19.
While stations, land borders, and international airports remain closed, precautionary measures are also being taken by the federal government to protect our seaports. Only ships that have been at sea for more than 14 days can dock in our ports after crew members have been confirmed negative for COVID-19. An exception to this 14-day restriction are vessels carrying oil and compressed natural gas products, because they require minimal or no contact at all between the crew and the ground personnel. With the increasing number of cases, Lagos is still the epicenter of the COVID-19 outbreak in Nigeria. The federal government of Nigeria has released 10 billion naira grant to Lagos State to increase its capacity to respond to COVID-19 outbreak. Another 5 billion naira special intervention fund has been released to NCDC to equip, expand, and provide personnel to its facilities and laboratories across the country. The federal government also, through the Nigeria Air Force, has made provisions to bring back essential NCDC staff who have been away on training but could not return to Nigeria due to the instituted measures to close down airports in Nigeria and other countries. The Chinese government has promised to give us technical support for some of their experts, so we can connect with their experts on public health and the infection prevention and control measures, and also their experts in clinical management. So we shall be taking up that offer to get the expertise directly from China, who have a lot of experience in this, with this problem.
And the nation's commercial capital, Lagos, may soon be locked down to help check the spread of the COVID-19 pandemic. And that's according to Governor Babajide Sanwo-Olu, who gave the indication during a briefing earlier on today. He also asked parents of some students rescued at the Seme border to rest assured that their wards are in safe hands.
As things stand now, most of the cases we're dealing with have been imported cases. But we're also starting to see a trend that suggests that we may be entering a phase where community transmission of the disease could also be coming in. Fortunately, because we have shut down all the land, sea, and air borders, we are now able to fully focus on tracking and halting within our communities. I'm pleased to also know that all our confirmed cases are doing well, and they are all in stable condition. Of course, we know that a total of 3 have since been discharged. We are in the process of reconfirming another 5 or 6 additional patients that once they turn a second negativity, they might be allowed to go home later tonight or tomorrow once the results are out. We have people who, because of their daily means of livelihood, have been affected. And so we needed to have some stimulus package set out immediately. We are by this intervention targeting those who earn daily wage to feed their families, those who are vulnerable, what we consider as the lower part of the triangle, the elderly, and the fiscally challenged. So at the first instance, we're targeting a food bank for about 200,000 families, 200,000 households. I will also be signing what we call the Lagos State Infectious Disease Emergency Prevention Regulation 2020. It's an exercise of my power conferred on me by the federal and state laws. These regulations will give legal and enforcement backing all our actions that we have taken so far. And it would help us ensure that we contain the spread of COVID-19 within Lagos State. They also prescribe stringent penalties to all those who defer or fail to comply with the directives that will be issued in the regulation. Overnight, we had to rescue about 14 Nigerian students that were stranded at the Seme border. I'm happy to inform that they've all been brought to the hospital this evening, and all of them would be isolated and they will need to go and have themselves tested. If they all turn negative, we'll allow them to go home and be joined with their family, because I know that some of them, their parents are pretty anxious right now, but they're in safe hands. I saw them and I said to them that they don't have anything to worry.
Meanwhile, the Lagos State Commissioner for Health, Dr. Akin Abayomi, has raised an alarm that the state may record up to 39,000 cases of COVID-19 in a worst-case scenario. Dr. Abayomi, who spoke at a media briefing today, explained that of the total of now 70 cases in Nigeria, Lagos State has 44, the highest number. He says with social distancing, the figure could be limited to 13,000 cases. He adds that compared with the number of confirmed cases in other parts of the world, the state is definitely doing something right.
The reason why we've implemented social distancing is the incident commander is fully aware of the trajectory that is possible. And the only way to address that is to implement social distancing. Our mathematical modeling shows that the worst case scenario is that we may see up to 39,000 cases in Lagos State. However, if we practice good social distancing, we might be able to limit that to about 13,000. And the graphs there show that indeed, if we carry on and the public are receptive and compliant, we will soon see that yes, we're expecting a few more cases, but the responsibility is with the community. If you're able to follow our instructions and distance yourself, you will prevent the opportunity of the virus from increasing its victims, because you don't give it the opportunity to spread from one person to another.
The Lagos State Commissioner for Health. I think at this point in time now, we should be going to the Federal Capital Territory, Abuja, which, as you heard earlier in the day, recorded a number of new cases. There, our correspondent, Kayla Megwa, is standing by. Good evening, Kayla. What's the update this evening?
Good evening, Mr. Ladi. The update, of course, like we've been announcing, is the fact that we have 3 new cases in the FCT, making the total number of people with COVID-19 in Abuja 14 people. And now with these figures rising, and with no actual rhyme or reason, just keeps rising. With these figures rising, you would think that there'll be more compliance in the nation's capital, but there isn't. The city center, though, driving around the city center today, we did notice that many places have closed down. We've seen some of the businesses that were open yesterday, many of them have shut down today, and many people are observing the stay-at-home order in the nation's capital in the city center. But the same is not the case at the suburbs. We're talking Kubwa, places like Gwarimpa, Dugbe, all those other places. It's business as usual. There's actually a furniture market we went to today, and they were still working fully as though nothing is going on. I think more information, maybe. We spoke with a lot of people today, quite a number of people, and you know, the major thing that I realized today was that many people don't have the information that they need. For instance, some people don't know you're supposed to spend at least 20 seconds under running water washing your hands. And apart from information, talking to people today, we saw that many of them think that some of the restrictions, some of the rules for the period that we're in are not feasible, considering the fact that they do not have power supply, there isn't enough water. Someone told me, how am I going to wash my hand under running water when I don't have running water in my house? I'm going to waste 20 seconds under water that I bought, you know? So we saw those kinds of conversations going on today, and a lot more things going on in the FCT. But compliance level, not good enough in the suburbs. City center is doing their best, but we might be in a lot of trouble if we do not do the right thing in the FCT now. Now,
taking a look at it, Kayla, today is the last, well, if you like, weekday, and we're going into a 2-day weekend. So the question is, if the compliance level has been low during the week, what's the prognosis for the weekend when people traditionally go out?
You took the words right out of my mouth, Uncle Ladi. In fact, I'm thinking about Sunday. It's the Easter season. And I spoke with someone who was telling me that I know that they have confirmation in their church on Easter Day. She has to be there. You know, and I was telling her about, you know, how many of you, she said she was number 184 on the list of people that were going to be confirmed in her church on Sunday, and that she has to do her confirmation. You know, so it's almost like people are trying to, it's almost like trying to face a reality that will hit everything that you know and believe to be true. So that's a little difficult for people to grapple with. You know, I keep wondering about how Easter is going to be. Are people going to still want to go to church on Good Friday? Some churches are still doing Stations of the Cross, which is on Wednesdays and Fridays. You know, and then, of course, the entire Lenten season is about to end. So that whole period, there's a lot of church going around that period. And I don't know how the compliance level is going to be for that. We saw today visuals from Kano where people were in the mosque. The mosque was filled to capacity today in Kano. So the question is, do we need to apply stricter regulations? Does the military have to go in? Do we have to lock down and do what's happening in India or in Italy, where government officials are actually the ones going around and stopping people from going outside? You know, we don't know if that's what's going to happen. Are we waiting maybe for the numbers of deaths to increase? Are we waiting for something to cause an emergency before we take action as people here? But then also there's the education part, and I really cannot stress that enough. So we have all these programs going on, but some basic conversations are not being had. Many people do not know a lot of things that they are supposed to do with the restrictions that they're facing at this point in time. So more education probably, and then maybe we'll see the compliance level go up. I don't know. We're just going to be watching to see how people respond.
Thank you very much, Kayla, for that update this evening. Correspondent Kayla McGrath from Abuja. And returning to Lagos here, our studios here in Lagos, of course, we do have joining us Dr. Modupe Akiyinka, who is a public health physician. She's also a member of the Association of Public Health Physicians of Nigeria. Good evening to you and welcome.
Thank you very much.
Now, slowly, we are approaching what some have described as where we ought to have gone much earlier, which is this lockdown. Now, but it does seem as if the compliance level, you just listened to our correspondent in Abuja saying that maybe because of lack of awareness or education or information, but that the awareness is still low. In other parts of the country, we have similar reports. Even in Lagos, the nation's commercial capital, there are pockets of non-compliance with social distancing, the issues of regulations and so on. How dire can this situation become if this is not addressed quickly?
The situation can become really, really bad. Once we start to have a lot of community transmission of COVID-19, then it means we want to go through what Italy has been through, what the US is facing now, where we have cases coming into hospital and they don't even have beds, they don't have people to take care of them, and then they're turning them back. And these people are people that actually really need help, and they're in distress. They need the help, or else they're going to die. All right. So it's something that we have to bring to the table so that everybody gets to know. The information has to go out. We don't want to go the way of Italy. We pray we do not go the way of Italy.
People keep pointing to the example that I think it was as at February 3rd, Italy had only 5 cases. And when they tried to implement some of these measures and people didn't respond appropriately and so on, and then there was this huge spike.
Escalation.
So when you talk of us going the Italy way, this is actually what...
And that is what we do not want to do. That is why people need to stay at home. They need to practice this social distancing, keep away from other people. You don't have to go to church right now. Have church in your house. Practice social distancing, have the church in your house. Pray in your house, have the mosque in your house, but not with other people. Each one of us has to look at it in this way, that we have the virus already. And so we do not want it spreading. And if we don't want it spreading, then we should stay at home, except for essential services who have to go out. And when people even have to go out, because people will still have to go out for like food and supplies like that. And then when people go out like that, they still have to practice that social distancing, keeping away, so that we are keeping other people from getting it. If we're able to get that right, and we can hold it, we can buy the time, so that we reduce, we flatten that epidemiologic curve, that curve of the disease occurrence. And once we're able to do that, then our facilities will then hopefully be able to cope with the cases that come in, which is why it's a good thing that we're having all the other isolation centers being developed all over the place. Because if we want to look at just what we have on ground now, if we have an explosion of cases, then we're in deep trouble.
Let me put you on pause there. We'll take a break. When we come back, I'll let you conclude that thought, and then I'll ask you about testing as a key to all of this. But that will be after this break. Please stay on this. Thanks for staying tuned and welcome back to our COVID-19 special here on Channels Television. Before we return to our discussion, let's take you through once again, as we have for the last couple of days, the self-isolation guide. People keep talking about staying at home, staying at home. What does this really mean? And what is there to do within the 14-day period required? Under self-isolation, you're purposely staying at home away from everyone for a period of 14 days. Do not go closer than 2 meters, that is 5 feet, to anyone. Stay in a well-ventilated room alone. Keep away from everyone, including family and pets. Do not use commonly shared household items. Ensure you work from home. If you have to work, do so from home during this self-isolation period. Ensure you have adequate supplies of food, water, toiletries, medications for existing ailments and other necessities. Practice clean hygiene regularly. That is, cover your nose and mouth with tissue or elbow when coughing or sneezing. Immediately dispose used tissue in a covered bin. Wash your hands with soap and water. If not available, use an alcohol-based hand sanitizer. Frequently clean and disinfect surfaces. Clean and disinfect your touched surfaces in particular, such as door handles, furniture, and others using household disinfectants. And contact us if you feel sick. If you feel feverish or keep coughing, have a sore throat, or difficulty breathing, call on the NCDC for immediate help. The numbers are there and the various handles are there. The number is 080-097-000010. And then, of course, there are other numbers there. Now, to return to our discussion here in the studios, before we took the break, I was talking to Dr. Modupe Akinyinka. Thank you for staying with us. Now, before we went on the break, you were about concluding your thought about the issue of isolation centers. The information is that all NYSC camps in the 36 states are to be converted during this period to isolation centers. Will that help?
That will help once we start to have many more cases. But what we need is not just the isolation centers, because those centers are just the facilities. We need people that will work in those centers. We need the equipment that will work in those centers, like ventilators, and then we need personal protective equipment for the staff and the health workers that will work. And so we need a lot more than just building the isolator or setting up the isolation center. So it's a step. Yes, it's a step in the right direction.
Now, the donation from the tech billionaire in China, Mr. Jack Ma, has arrived, we're told, in Nigeria. And test kits, the PPEs you referred to, and then face masks. And they've said they will distribute this fairly quickly. Now, in distributing this, particularly the test kits, of which we understand there are about 20,000 of those across the 5 testing centers, it brings me to the question of testing that I said I was going to ask. We're having 70 cases as we sit to speak now. But people point to the fact that we haven't done that many tests. With this new kits that have come in, how would you, if you were in the position, how would you do this now that you have the kits to do a bit more?
Well, number one would be based on the number of cases that each of the states has. So the kits should be distributed. And then, of course, the ones that have a higher burden, like Lagos, would get more, because the people that need to be tested are the people that are suspected cases, people that are contacts of
already
the confirmed cases already. And so contact tracing, to be able to get all of their contacts and then get them tested. And then also other people, if people are having symptoms or they think they have been in touch or in contact or close contact with those cases, they also need to call in, and then all those people need to be tested. Because when we test more, then we will know whether there's really been enough community or lots of community transmission of it. Because most of the cases that we have now are those that were imported, and then they are close contacts. So if we're able to test more and we find that it's still just their close
that level and
yes,
the contacts?
Yes, then at least it gives us more reassurance that we're winning this war. And we need to win this war. We can't afford to lose so many lives on
Now,
account of
there
COVID-19.
are, I want you to talk about some of the myths. I mean, you're a physician. We've heard some of them. We've heard some myths actually about how this can be tackled. Someone was still telling me earlier today about the garlic solution, and lemon and bicarbonate, and there were those who also spoke about chloroquine. What are the things that we shouldn't be attempting to use for this? First, let's start from there before we go to what we could.
Okay, number one should be that nobody should be attempting to use chloroquine right now, because it's not been proven as a therapy for it. And besides, the person using it has not been diagnosed with COVID-19 in the first place. So people should please refrain from self-medication, particularly with chloroquine or any other drug that they think is going to help the matter. So if people are having symptoms, then the thing to do is to call those numbers and get in touch. Self-isolate, like we have been told how to exactly do that, if they believe that they have been in close contact with cases of COVID-19 already. So self-isolate and then call those numbers instead of trying to take the drugs. Now, things like garlic and stuff like that, those things have not been proven to be able to prevent infection. So it would help each one of us to stand with those things that are proven, such as social distancing, keeping a good distance so that you don't inhale the droplets from other people when they're talking or when they're coughing or when they're sneezing. And then washing our hands, you know, they're simple things, basically, really. Washing our hands with soap and water for at least 20 seconds. And that's washing for 20 seconds means that you're still washing with the soap.
Not removing the soap and just doing your hands like that.
And then 20 seconds. So it's still washing with the soap and then washing the hand very well, the back of the hand, washing everything completely, and then at least lasting for at least 20 seconds, which means it should last for longer than 20 seconds. So we're sure that the virus has gone off if, peradventure, you have been in contact with the virus. And then, of course, if you do not have access to soap, then soap and water, running water, then you should use an alcohol-based sanitizer and do the same, you know, rubbing all around to make sure, and then avoid touching the face. It's very easy for us to touch the face. We're used to it, but we need to stop it. At this time,
point in time,
yes, we need to stop it. So if you need to touch your face, please go and wash your hands before you then touch your face. And then, of course, social distancing, and then basic personal hygiene. Wash your hands at critical points after using the toilet, before eating, you know, frequently as possible, so that peradventure you just come in contact with it, you're able to get rid of it. And then,
why do you think it's so difficult to imbibe in our own system? Especially I'm not talking about the hygiene bit. The hygiene bit ought to have been part of us even before COVID-19 came along. But the social distancing part, you still see people almost shaking hands before they remember, and then people say, oh, sorry, you're too close to me. And the other person say, what's the big deal about being close to you? And so why do you think it's so difficult to imbibe? Is it a cultural thing, perhaps?
I think it's a human thing, really, and a closeness thing. We feel like, okay, you're close to this person, and so you want to be, you know, you want to be close to the person. But the circumstances now dictate that you shouldn't be that close to the person. If you like the person, and if you love yourself as well, you shouldn't be that close to the person. And then sometimes, for some people, it's just habit, really, because some people are not really that close, but they have formed the habit of being so close, and then sometimes you're like, oh, you're too close, you know. So we need to change our habits and maintain that distance, that social distance that will protect us and protect everyone else as well.
But while we're doing that, there's also the other aspect, which is, okay, fine, the things we are not to use. But is there hope? Do you see any promising lines of inquiry on the kinds of medications that eventually could come online? Because some people have mentioned some things that are being tried that are being worked in other, not here, I mean in other, other societies.
settings.
But do you see, from all your readings and all your literature and research, do you see anything like a vaccine in our horizon anytime soon?
Well, from what I've found out about the COVID-19, tests on developing vaccines are in progress. But there are reassurances that it may be up to like 2021 before we get a definite one. But there are already clinical trials that are in place on the use of drugs. I believe the US has a clinical trials running on it. And I think I heard something today while I was here in the studio waiting about even clinical trials starting in Lagos. I think somebody mentioned it. I think it was the commissioner, Professor Abayomi, yes, mentioned it in collaboration with NIMA that Lagos State Ministry of Health is starting clinical trials as well, because we're having patients, so they can actually go ahead and then try out some of these drugs. So they may be using antiviral drugs, they may be using maybe some antibacterial drugs as well, and chloroquine may also be something that may be used as well.
In combination possibly with other things.
Yes, in combination with other things.
Very interesting. We'll come back to that discussion, Doc. But in the meantime, let's go to Bauchi State, where blood samples of 4 persons from Gombe State who came in contact with the Bauchi State Governor, Bala Mohammed, are being screened for COVID-19. Our correspondent, Hajara Aliu, who sent in the story, also reports on the level of compliance in Bauchi State.
Thank you and welcome to Bauchi State. The second person that tested positive for COVID-19 in Bauchi State is being isolated here at the Sani Sami ward of the Abubakar Tafawa Balewa University Teaching Hospital, Bauchi. This morning, this place was converted to an isolation center to manage COVID-19 patients. At the time we visited earlier, the place was still being prepared to meet specifications for COVID-19 isolation centers. The place has a 100-bed capacity. And previously, there were patients who were on admission here, but they've been moved to other sections of the hospital, including those suspected to have Lassa fever were also being admitted here. But right now, a temporary Lassa fever camp has been set up for them just behind the COVID-19 isolation center. We're being told that the patient here has only exhibited mild symptoms of the COVID-19, which includes cough and also fever, but he is responding to treatment so far. Contact tracing has begun for this patient, especially for those who had close contact with him, and so far over 10 samples have been taken. And from our neighboring states, Gombe, there is no confirmed case of COVID-19 yet, but there are 4 people who were reported to have had close contacts with the Bauchi State Governor when they came visiting at a time when he was believed to have been infected with the virus. Their samples have been taken for testing. The governor has been taking measures to contain the spread of COVID-19 in his state, and which includes the ban on public gathering. There is also a ban that has been imposed on interstate travels in Gombe State, and this will take effect from Sunday. From the isolation center here at the Abubakar Tafawa Balewa University Teaching Hospital, Bauchi, Hajara Aliu, Channels Television News.
Thank you very much, Hajara in Bauchi. And from there, we move on to the southeast, specifically Imo State and Owerri's state capital, where our correspondent, Eitokwe Kuteyi, has an update on the situation. Good evening, Eitokwe.
Welcome to Owerri, the Imo State capital. Yesterday, the Imo State Police Command talked about enforcing the directives of the state government in preventing the coronavirus from finding its way into Imo State. Well, this task is not only for the Imo State Police Command. The NCDC, Nigerian Security and Civil Defense Corps, has also joined in this task. The NCDC says it's deploying about 300 personnel for emergency response, sensitization, and enforcement of the social social distancing as well as the limited gathering across the state. The state commander Raji Ibrahim says his men will be positioned in strategic places across the state to enforce these directives of the state government. He also says his men will be on red alert to protect state and federal assets, so hoodlums do not take advantage of this period to carry out their nefarious activities.
Itokwe Kute reporting from Owerri, the Imo State capital. Now let's take a look at updates coming in from the rest of the world. Italy has confirmed 969 more deaths from this virus in the past 24 hours, taking the country's total to 9,134. There are 4,401 new infections, making a total of 66,414 current cases. This is believed to be the sharpest rise in fatalities that any country has seen so far throughout this pandemic. Meanwhile, in the UK, a total of 759 people have now died, while 14,579 have tested positive. The rise in the death toll comes after the announcement that Prime Minister Boris Johnson and the UK Health Secretary Matt Hancock had both tested positive for the virus.
South Africa has announced its first deaths from coronavirus as cases there surpasses the 1,000 mark. Security forces have begun enforcing a 3-week nationwide lockdown in an effort to stem the spread of the virus. All but essential movement is forbidden, and both the army and the police are enforcing the measures. According to Johns Hopkins University, the total number of infections is now almost 580,000 cases globally. More than 128,000 people have recovered from COVID-19, while more than 26,000 people have died, including 1,438 in the U.S. Italy has the highest death toll with more than 9,134 deaths.
And several world leaders have been wishing Prime Minister Boris Johnson a quick recovery after he announced that he tested positive for the virus. Serbian President Aleksandar Vučić was the first national leader to send a message of support to the Prime Minister on Twitter. On the news that the British Prime Minister had tested positive, he said, quote, "Get well soon and keep fighting." European Council President Charles Michel also wrote on Twitter, "Europe wishes you a speedy recovery." Meanwhile, the head of the World Health Organization, Tedros Ghebreyesus, told Mr. Johnson, "Please take good care." He went on, "Your leadership and commitment to beating the coronavirus are key to saving lives." Well, we return to our discussion here in the studios with Dr. Modupe Akinyenka. It would appear as if this time this is starting up down, because a lot of those, even here and elsewhere, a lot of those who have been affected are very high-profile people. So this virus is no respecter of persons, so to speak. But that message doesn't seem to be going down. Do you think more enlightenment, or is it enforcement like South Africa is doing, that is needed?
I think we need both, more enlightenment and also enforcement, because people may, from the Abuja one, people were like, what's their problem? They have to go to church, they have to go for confirmation, they have to go out, they have to do things and all of that. But if they understood the gravity of what is happening and the fact that so many could die if we just allow things to continue the way they are and not behave as if nothing is happening, then I think it would drive home the message better. And then, of course, there's enforcement, because we're human beings. Some people will still not, even with all the education and all, they'll still want to do their own thing. So we need to enforce it. The other day I was reading about Italy, and they had arrested or charged about 70,000 people or over 70,000 people for breaking the COVID-19 restrictions. So we need to enforce it as well, because education alone may not be able to do it, but education definitely everywhere. Everybody should have that information in the different languages so that people understand in the villages, people understand that, we need to keep
this
social distance. We need to wash our hands. We need to, prevent this disease from spreading like wildfire.
I'll come back and ask you a few more questions, but that will be after we take this final break on the program. Please stay. Thanks for staying tuned. We are in our final moments of today's edition of the program, that is this segment of the program. But before we get back to the discussion, let's go to Kano, the capital of Kano State, where Nanchin Vincent is our correspondent there, and she has an update on the situation, including what happened today at Jumat prayers. Nanchin?
Today is Friday, and Friday is a very special day in Kano State. It is a worship day where Muslims troop in their numbers to the mosque to offer their Jumat prayers. It wasn't very different today, as they also went in such beautiful numbers. They went into the mosque to say their prayers. However, today the state government, the Kano state government, commenced disinfecting the environment to ensure that everybody who comes in for the Jumat prayers is safe. There were disinfectants and also hand wash to ensure that people sanitized their hands and washed their hands before going into the mosque to pray. However, let me speak to some of the residents today on how they fared at the mosque during the Jumat prayers. Sir, can you tell us how Jumat prayers was today?
Yes, Jumat's prayer was conducted peacefully in a very serene environment. Thank our executive governor, Abdullah Umar Ganduje, for taking a proactive measure by providing, first he constituted a committee under His Excellency, the Deputy Governor of Kano State, to checkmate the spread or the perceived spread of, perceived case of coronavirus in Kano State and Nigeria as a whole. But we thank God we haven't recorded any case of coronavirus in Kano today, as of today. But the state government has taken a proactive measure by disinfecting most of our mosques.
How was the Jumat prayers today at the mosque?
Okay, the congregational prayer, there is no anything. There is no problem. Many people are attending the mosque more than their past.
All right, as you have heard, it was orderly today at the mosque, and everybody went about their prayers in a very, very peaceful manner. Right now, Kano State today will be placing a ban on all interstate movement, and all of this is as efforts to ensure that coronavirus disease stays out of Kano State. From Kano Metropolis, Nanchin Vincent.
All right, thank you, Nanchin, from the city of Kano. Doc, we have 1 minute to round up this. What would be your final thoughts as we look at this? The federal government says we are on the cusp of that community spread. What do we, again, have to do for us not to cross over?
We need to make sure that everybody is practicing social distancing. People need to stay at home and keep away from crowds, from congregations, and avoid spreading or getting the disease. And if they do have it, or if they think they have been in contact with people that have been confirmed cases, then they should call the numbers. They don't have to go there. They should call the numbers, and then they will come to them. Yes. And then we need to get more of these contacts tested, as many as possible. And people should not hide. It's not something that needs people hiding, because once people go underground and they hide, then we're not able to monitor them. And if we can't monitor them, then they'll be spreading it. And then someone can then go to like a Jumat service. And instead of spreading to like 3 people, he spreads
to thousands.
To thousands.
Thank you very much, Dr. Modukpe Akinyenka, who is a member of the Association of Public Health Physicians of Nigeria. Thank you so much for joining us. It's been a pleasure.
Thank you for having me.
Thank you very much. And finally, Nigerian music star David Adeleke, popularly known as Davido, says he has gone into self-isolation. He explained that he took the decision after his fiancée, Chioma, tested positive to COVID-19. The music star announced this today via his verified Twitter handle. According to him, his fiancée had recently returned from the UK while he had been in the United States of America. He also confirmed that their few-month-old son tested negative. That's it from our studios, the COVID-19 special studios. Tonight, thanks for being with us. I am Ladi Akiri Doluale. Good night.